So the next section in Chapter 2 talks about trauma-informed teletherapy guidelines. So, of course, teletherapy has been around for many years. However, the COVID-19 pandemic really fueled just an explosion in the use of teletherapy because it wasn't safe for many people to meet in person. So it was important that new guidelines for safe and effective and trauma-informed teletherapy were developed. So teletherapy, in some ways, really embodies trauma-informed care philosophy and principles. For one, telehealth can be much more accessible for many people who wouldn't be able to access therapy, group work in person, either because of the cost involved, because of mobility issues, because of the lack of services in their geographical area. Telehealth really is a game changer for many people, especially in rural areas or folks who struggle to afford or find affordable and accessible group therapy options. So telehealth is really important in that way. Oftentimes telehealth is cheaper than in-person therapy because the provider doesn't have the additional cost of paying for a building, paying for rent, or leasing out a space, and all the costs that go into that. Telehealth can be really empowering. And for many trauma survivors especially, telehealth might feel more comfortable and even safer than going to a strange place or a sterile medical environment, a new building, a new city or town that they've never been to meet in the office of a professional to engage in therapy. Whereas with telehealth, they can use a laptop or a phone or a computer and sign on to the session from the comfort, the safety of their own home, their own private space. So, of course, for many people, this is going to feel safer and more comfortable, which is especially important for trauma survivors. Although for some people, they're not going to have a safe place to do telehealth from. Maybe their home isn't and never was a safe place. Maybe they don't have the privacy or the luxury of a private space within their home. And so we need to take this into consideration as well. Some of the research has shown that group teletherapy participants feel a greater sense of safety, transparency, even honesty and comfort in online sessions than they do in in-person sessions. So teletherapy for groups is an important option to consider when you're offering groups. And it really expands the ability of group members to participate in your groups because your kind of span of folks that might be able to be in the group is no longer limited by physical or geographical proximity, which creates more choice for group members. I think it really allows us to create more specialized groups because we have a larger sample of people who might be able to attend the group or participate in the group. It's no longer limited just to people that could travel, 30 to 60 minutes, to be in person for that group setting. But now it can include people within the entire state or throughout the country, even in some cases, although many of us are limited by our state licensing in who we're allowed to do telehealth with. So either way, telehealth creates far more options for participants in choosing groups, that they're no longer limited simply by the groups that are offered within geographical proximity of where they live or work. Telehealth groups are more time efficient in that it doesn't involve travel time. So many people either simply can't afford the time involved with traveling to and from a therapy group, or some people use it as an excuse not to carve out time in their schedule to attend a group. Either way, telehealth sessions are much more time efficient because they don't involve travel time. So for a 1 hour or 90-minute group session, if it's in person, many times for participants, that requires a 2 to 3 hour block of time in their schedule because they have to consider all the time driving to and from the group, not just the time that the group meets. So telehealth is much more efficient in that way, much more accessible in terms of time involved. Telehealth allows for individuals to come together for a group who probably wouldn't have been able to physically gather together easily before. And it allows for more specialized groups for specific populations due to the larger geographical region that we can pull attendance from. So I think this can be really important for that 6 trauma-informed principle related to culture, gender, and identity, in that we can create groups that are more specialized around different communities and different issues, rather than just broader therapy groups. Of course, there's also risks and limitations to telehealth, in addition to many of its strengths. Telehealth practice laws can be really limiting. If you're a licensed mental health provider, you're usually limited to only providing telehealth to individuals who are physically in the state you're licensed in at the time of the telehealth session. So while it might be easy enough to have people sign on to your group from around the country and around the world, oftentimes this would be considered practicing outside the scope of our licensing, and our professional liability insurance might not cover any issues that emerge if we're practicing with folks outside of the state we're licensed in. So it's really important that you stay up to date on the ever-changing telehealth licensing practice laws. There's also interstate licensing compacts that are being created. Some professions have done a better job than others in getting those off the ground. However, each state has to individually pass legislation to opt into that interstate licensing compact. So from what I understand, the psychologists have done a pretty good job and have gotten a couple dozen states to sign on to that compact. The counseling compact is gaining lots of traction. The social work licensing compact is still getting off the ground here in 2023. It'd be important that you're aware of your own profession and licensing compact options. Another limitation to telehealth practice is that practicing through telehealth requires different competencies for the professional, and especially related to technology. So we need to make sure that we are competent and able to skillfully use any telehealth technology that we're going to use. Sometimes it can be really helpful to have a co-leader when you're doing telehealth groups. You can have someone who can help manage some of the technology while the other co-facilitator is managing the group. In telehealth groups, there's additional risks to privacy and to confidentiality. So you'd really want to be aware of these additional risks. Some things you can do to mitigate some of those risks would be to use screen protectors or encourage group members to use screen protectors for privacy on their mobile devices or their laptops or computers if they're not able to sign on to the group from a private space. And of course, to use headphones when a private space is not available, so that people who are in their physical space aren't going to hear the things that other people in the group are saying. In Zoom groups, there's the risk of Zoom bombing, which is when uninvited people get a hold of the Zoom link and jump onto the Zoom meeting and start taking over the group, sharing inappropriate images or saying inappropriate things during the group. I think Zoom has done a pretty good job of creating features that allow us to prevent Zoom bombing, such as the waiting room feature or requiring passwords for Zoom links. So you want to be aware that you want to make sure you're aware of these features so you can prevent Zoom bombing. Now, there was a couple authors that put together and created 5 different ethical arguments about the risks of doing therapy online. And so their arguments were 5 different areas. One was about the confidentiality, privacy, and security risks of online therapy. Second was about the lack of therapist training in telehealth. Many therapists, perhaps most therapists, have zero training on how to provide therapy online, especially therapists that did their training and supervision prior to the COVID pandemic. Prior to 2020, there wasn't a whole lot of information, teaching, and education in graduate schools about online therapy. It was almost exclusively focused on providing therapy in person. The third area had to do with communication problems related to the technology. So, this could be things like unstable internet connections, having trouble with muting or unmuting, or turning on or turning off cameras during the sessions, difficult to hear or understand due to microphone or speaker problems. So there's different communication problems that emerge when we're using technology that just aren't present in in-person sessions. The fourth area they outlined was a lack of research on online therapy. Most of the therapy research was focused on services that were provided in person, not online. And the fifth limitation has to do with some of the complexities in managing emergencies during teletherapy sessions. So if there's an emergency, a medical emergency, a mental health emergency, a safety emergency, and the client is in person, it's a lot easier to address that, to manage that, to provide the individual or individuals with help, to get them to help, to get help to them. Whereas when everybody's online in a different physical space, there's a lot more complexities in managing emergencies. If we're on a Zoom meeting and somebody all of a sudden has a medical emergency, we need to know exactly where that person is so we can get help to them. If somebody's on a Zoom session, telehealth session, and starts to have a mental health crisis, they might turn their camera off or log off of the Zoom session without telling anybody, and we might not be able to get them help right away. Whereas if they were in person for the group session, we would be able to see what was going on, to ask questions, to make sure that everyone was okay before the group ended. So there's a lot more limitations and complexities in managing emergencies for telehealth than there is for in-person sessions. So I want to run through the 6 trauma-informed principles and different ways of cultivating these trauma-informed principles in telehealth. So the first trauma-informed principle is about safety, and some simple strategies for implementing safety on telehealth in group work would include things like obtaining the patient's location at the start of the session, really having a thorough informed consent process to outline some of the risks of telehealth, the limitations of confidentiality in group work and on telehealth, to get a commitment to confidentiality from each of the group members at the beginning of the group process and maybe even at the end of the group process, to talk about and confirm privacy and security of each patient, each client's physical and virtual space, to discuss the importance of keeping the video feed on and or communicate with the group leader about why somebody's turning their camera off so we can make sure everybody's safe and can help them manage feelings related to lack of safety or discomfort or feelings of overwhelm during the process if they were to turn their camera off. And to provide local and virtual resources for support, additional treatment, referrals, and emergency care based on the physical proximity, the geographical location for each individual based on where they're signing on to the group from. The second trauma-informed principle is trustworthiness and transparency. And so different ways to cultivate this in telehealth groups would involve utilizing reliable and secure telehealth platforms to promote transparency related to any noise in the background in the environment that somebody might be attending the session from. If somebody's in a public space and they're on a therapy group session and other people can hear discussions going on in the background, it'd be important to be transparent about what that noise is. To suggest that each person sit far enough from their camera so that others can see more of their body language. If everybody is sitting this close to the camera, you're not going to be able to see what they're doing with their hands, what's going on with their legs, with their body, their posture. Whereas if everybody steps away from the camera a bit, you can see much more of their body posture. You can see their hands, you can see their torso. You could see if they're leaned over, maybe in a more depressed stance, or if they're sitting up more comfortably, or if they look confident or comfortable, or if they look upset or angry, or if they seem afraid or sad. You'll just have much more physical cues to be able to have more transparency about what's going on for somebody. And then you'd also want to provide clarity on the telehealth and the group processes, which are going to look different for telehealth groups versus in-person groups. In terms of peer support, in telehealth sessions, you'd want to promote mutual aid and group cohesion, just like you would in individual sessions. But on telehealth, you'll have to do this in different ways. You might use things like group discussions, breakout rooms on the telehealth platform, the chat feature, or other processes adapted for the virtual group space. You could encourage participants to unmute their mics and contribute to the group throughout the process, and or use nonverbal indicators of support, such as emojis or images or physical non-posture indicators of support, or even the chat box. In terms of the fourth trauma-informed principle, collaboration and mutuality, ways to cultivate this on telehealth groups would include clearly identifying group goals and purposes that promote collaboration between the group members, and helping to develop a sense of solidarity and cooperation in the online group space by highlighting shared experiences. And again, you could do this through engaging the group members on telehealth. Sometimes it's harder to engage group members on telehealth than it is in person. There's probably more opportunities for distraction when somebody's signing on online than they are in person. The fifth trauma-informed principle is about empowerment, voice, and choice. And so ways to cultivate this in online groups would include discussing group norms related to keeping your microphones muted or unmuted, tracking all participants throughout the online group process, and ensuring that everybody has a chance to participate based on their comfort level. You want to make sure that you give everyone a chance to speak up and that you give everyone choices throughout the process. So you might want to initiate on ongoing check-ins and affirmations of choice throughout the group. And then you would be helpful for group members to consider offering alternative options for sharing instead of verbal sharing or talking. Again, things you could do to allow group members to engage in different ways online would be using emojis or the chat box or nonverbal ways of sharing. The sixth trauma-informed principle has to do with culture, history, and gender issues, and ways to address that online would be to intentionally create group spaces that are inclusive and affirming of diverse identities, diverse communities, to consider the impact of social determinants of health, such as housing security, internet stability, the affordability of computer equipment, access to private space for telehealth sessions, access to childcare, the impact of poverty, language translation, nutrition, racism. All these different social determinants of health have a determining impact on one's access to both in-person and online services in different ways. You'd want to also be aware of the patient's comfort level in revealing details of their personal space during the session. So you might educate or encourage clients to use a background that a feature, if you're using Zoom, for example, that blurs out the background or gives them an option to have a digital background in case they're anxious about other people seeing who or what might be in their background, maybe the cleanliness of their space or the the simple lack of space that they have, or the other visuals related to their space, which might give indicators about wealth and income or poverty. Another simple thing you can do to address issues related to gender is encourage the use or display of gender pronouns next to participants' names. So this has become a pretty common practice in online settings. You could specifically design groups that are accountable or that take into account preferences and limitations related to different communities, and provide simple instructions for participants, especially those less familiar with computers, technology, or telehealth video platforms. So these are all different ways that you can practically, in very practical ways, implement strategies to operationalize the 6 trauma-informed principles in online telehealth groups. At this point, I want to pause for a moment, and I want to challenge you to reflect on how comfortable are you facilitating online groups versus in-person groups? And where are your varying levels of competencies and competence, your scope of competence perhaps, as a facilitator for online groups versus in-person groups? And perhaps you could include hybrid groups into that. Do you feel more comfortable and skillful facilitating in-person groups? Do you feel more comfortable or skillful facilitating online groups? And where's your level of comfort and skill in facilitating hybrid groups where some of the participants are in person together and other participants are online together? It's also important that you take a moment and reflect on if you've educated yourself on the ethical, legal, and clinical best practices for facilitating online groups, which are going to be different than the ethical, legal, and clinical best practices for facilitating in-person groups.